Hong Kong has officially recorded over 1 million COVID-19 cases since the start of the pandemic. 20,082 new infections were reported in the city on March 18, bringing the overall total to 1,016,954 cases. But the actual number may be far greater than what's been reported to authorities. The University of Hong Kong's Faculty of Medicine estimates that some 3.6 million residents have been infected. And by the time the fifth wave is over, it predicts that around 4.5 million people will have caught COVID. The Hong Kong U Medical Faculty's current modelling suggests infections will drop to below 100 cases a day in May. Faculty Dean and top government advisor Dr. Gabriel Leung tells the Post Hong Kong has two options going forward. Sticking with the government's dynamic zero-COVID policy would involve keeping some social distancing measures in place and carrying out universal testing to cut remaining transmission chains. Chief Executive Carrie floated the idea of universal testing in late February. Many people reacted by panic buying food and supplies for fear of a citywide lockdown during the testing. Lam now says such an exercise remains a possibility, but is not a priority. She's also re-evaluating the strict social distancing measures that have been in place since January. They include flight bans to 9 countries, lengthy hotel quarantines for people entering the city, suspending face-to-face learning in schools, and prolonged closures of venues such as pubs, gyms, and beauty parlors.
I have a very strong feeling that people's tolerance are fading.
As social distancing measures cannot remain indefinitely, Dr. Leung says the government should protect the public by building a more long-lasting hybrid immunity at an opportune time. This involves a mix of passive immunity through vaccination and active immunity from recovered COVID patients. For this to happen, Dr. Leung says the authorities must achieve 2 key conditions. Achieve at least 90% full vaccination among the elderly. Elderly residents have the lowest vaccination rate among eligible adults in Hong Kong. As of March 18, only 23% of residents aged 70 and above have received 3 vaccine doses. But it's the unvaccinated elderly who are the most vulnerable. They account for about 64% of COVID-related deaths in the city during the 5th wave. Procure 1 million or more courses of Paxlovid. Pfizer's oral antiviral drug specifically treats COVID infections and should be administered within 5 days from the onset of symptoms. The first batch of Paxlovid arrived in Hong Kong on March 14, but a confidentiality agreement forbids the government from disclosing the amount and its price. Dr. Leung says securing 1 million doses would minimize severe cases and deaths, while building up the population's natural immunity. He adds that if the government were to take this approach, anti-pandemic restrictions could be lifted in 6 to 8 weeks. The second way is better because we could have a sustained slow burn where we will have some deaths, he tells the Post, but hospitals won't be flooded and there won't be many severe cases. In Lam's March 17 press conference, Hong Kong's leader acknowledged it was time to reassess the situation. A day earlier, the senior mainland Chinese official who oversees Hong Kong and Macau urged authorities to plan for the next stage of the pandemic in an orderly fashion. Carrie told reporters an announcement on changes to the restrictions would be made on March the 20th or the 21st.